Good afternoon, Dr.
Hi there.
Dr. Drew. Can I call you Drew?
You can call me Dr. Drew. Yes, you can.
So lovely to meet you. Well, I'm Jenny, Najm Kassis.
Hello, Jenny.
And I'm an American here in Dubai. I've been here for 9 years now. And well, I'm a longtime resident of Dubai. So I'm curious. My first question would be, when was the first time you visited the UAE? And what was your impression of Dubai?
So my first trip came for business when we started the Beverly Hills Sunset Surgery Center some almost 3 years ago now. Was at a different clinic at Valiant in City Walk, and I was asked to join that group by Dr. David Matlock, my colleague from Beverly Hills. He and I have known each other, worked together for years. When he started this group to come here, I was one of the first that he approached. Do you have interest in coming? And at that point in my career, I was up for something new, something exciting, another challenge. So I said yes, and was coming for almost 2 years until COVID hit. And so it's been a year now. This is my first trip back. Now I'm here at Kakuna Clinic and still working at Valiant, doing cases, and also working at Dubai London Clinic, where I'm also operating. So I'm back, and I'm excited to be back.
Awesome. We're happy to have you here for sure. Because I'm from the US, but I've actually never been to Beverly Hills or California.
What part are you from in the States?
I'm from Pennsylvania.
Okay.
Yeah, so East Coast.
Eastern Pennsylvania or
Eastern
Western?
Pennsylvania, about an hour north of Philadelphia.
Okay, because there's a big difference.
I know
isn't
there
it?
is.
It's like Philadelphia and Pittsburgh are
very different, yeah. And I was reading your bio. You've spent some time in New York City.
I did my training in plastic surgery in New York City, which was great.
Yeah.
Happened to meet my wife in New York City, so kind of a New York romance. My kids were both born in New York City.
Very nice. All right, so I wanted to ask you, when you were growing up, did you envision yourself to be a world famous plastic surgeon, an author, and on TV, and all these amazing
Definitely not. I mean, from an early age, I had an interest in science, so I started biology, chemistry, physics at an early age. Then, high school, college, that continued interest in science, and I said, hey, I want to go to medical school. So went to medical school, and then in medical school you sort of reach the fork in the road. Either you want to be a surgeon or you want to be a medical doctor, more like an internist or family practice or whatever. Mm-hmm. So I knew I wanted to be a surgeon, and then as I learned more about plastic surgery, the combination of art and science, being a doctor first, of course, appealed to me as the best fit for me, and it happened. And then the rest of it, I had a successful plastic surgical career, and I met Dr. Phil. Actually, our kids went to the same school.
Oh, okay.
Dr. Phil is the one who started the Doctor's TV show with his son Jay. They're the executive producers. So when they decided to create this new show, sort of a spinoff of Dr. Phil, they auditioned me. I had an audition of sorts, and they cast me. They wanted a plastic surgeon. So that's how the TV part started. I was asked to do it, and I said, well, yeah, I'll try and do it.
Yeah.
And so 13 seasons now and going strong.
Amazing. So now to some surgical type questions. What would you recommend for the best bang for your buck if you wanted to do some mommy makeover? Or
well, that's a great question, and my go-to line is, now we have something for everybody. And I look at you, obviously you're young enough where you're not ready. We're talking about your face. You don't need a facelift, you don't need a brow lift, something like that, but it's never too soon to start with some of the smaller stuff, the maintenance stuff, starting with good skincare, maybe some lasers, some microneedling, some PRP, those type of things, some Botox. And people ask me that all the time. Is it true, if you start Botox at an early age, do you prevent those wrinkles from getting worse and deeper? And the answer is yes.
Okay.
And fillers, it's additive that we know that fillers do go away, but the more fillers you do get permanent results. And maintaining volume, that losing volume is part of aging also. So they all go hand in hand. And
Sure.
if you're good about doing things earlier on, I think you're putting things off
Being preventative
for some time. But there's so many different categories. If you've lost a ton of weight, you've got loose skin, then you're probably candidate for some tightening of that loose skin. If you've had kids,
I've had 3 kids, so
well, then you're probably a candidate for a mommy makeover if you want to get your body back. And I mean, it's not for everybody, obviously, plastic surgery, but mommy makeovers, I think, are some of the best things that we do for moms to get them feeling better about themselves after having kids. So typically that may involve breast surgery, either augmentation or lifting, tummy tuck, liposuction thrown in typically after pregnancy and getting a little older. You have fat that's deposited in certain areas. So I did one of those yesterday, a mommy makeover, so a tummy tuck with liposuction.
Now, I wanted to ask, when we discuss injections in the face, do you recommend fat? Is that the newer thing now, to do fat injections over?
Fat is a great option. We don't like throwing away that fat anymore. And we do liposuction. We like to put it to good use. So some of the uses, as you alluded to, in the face, I mentioned that losing volume is a part of aging.
Right.
So if you have fat, you have much more volume. So for a lot of people, reinflating them, especially in the cheekbones, along the jawline, nasolabial lines, temples, sometimes using your own fat is a great way to go. That you can just get, it's the most natural way to fill, and fat should last. When we remove the fat, we treat it in certain ways so those little cells are healthy and will last longer.
Can that be done within the same procedure?
Sure.
Okay.
Sure. Yeah. No, we take the fat, and very often we're doing liposuction. As I said, we like to put that fat to good use. We like it in the face. We're doing it in the breasts now. We learned with breast reconstruction for cancer patients that injecting fat works really, really well. Some women don't want breast implants now, so using your own fat is an option. And then finally, that we are putting fat in the backside, that old BBL Brazilian butt lift.
Yeah.
That's not for everybody, but very often, and I think it's trending now. We've seen that exaggerated inflation of the backside. I think that's sort of losing interest, but people still want some. So we are adding fat to the buttocks. If you have a flat backside, it helps, but we're not doing those big crazy ones that were sort of a craze for a while.
Right. Well, that's a good segue to my next question. If a patient comes to you and insists on doing some procedure that you just don't agree with because you have your own eye as an artist, how do you convince them not to do it, or do you do it and?
Well, patient selection is everything. And as a plastic surgeon, we want to please, we want to make people happy. We think that we can do that. We have a lot of confidence in our skills to deliver, but it's all about patient selection that we were taught. Excuse me. Picking the right patient for plastic surgery is just as important as the actual procedure, making that cut. So we want people, realistic expectations, doing procedures for the right reasons, and natural results. If somebody says, I want triple D's, and they're like 5 foot tall, I'm saying you're going to look ridiculous. That's not going to fit.
Yes.
Or if somebody's 60 years old and says, I want to look 20 again, that's not going to happen. I can't go from point A to point B. And if you try, you're gonna create something very, very unnatural. So I've had a lot of strange requests over the years, and if something is just so blatantly outrageous, then that's a flat out no. But very often there's middle ground, and you can say, well, we can't do that, but we can do this. Do you think that would make you happy? But you know, I get those requests, but I want to look fake.
Yeah. Oh.
I mean, I want to look pulled. I want my boobs to look fake. We get those requests, and that's when I say, you know, no, I don't do that. That's very often I say I wouldn't know how to do that, to create something that fake looking. So that's where it comes down to, as difficult as it may be, saying no occasionally.
Yeah. So what is your favorite procedure to do on a patient?
Well, I still like doing it all. I call myself like a decathlon guy. I still like doing everything in plastic surgery. That's one of the reasons I like coming here to Dubai, because I get a good assortment of different things. I am best known for my facelift and noses, probably, but at the same time, I still like doing breast surgery and liposuction and mommy makeovers. I still do it all.
Amazing. Well, we're very lucky to have you here, because if I were to do something, it's like I probably would never go to Beverly Hills, but you're here in Dubai, so that's just, it works out really well.
Well, thank you. And I enjoy coming here. Even though it's 14 hours, you get used to it. You fly over the pole, and obviously Emirates is not a bad ride to go. And obviously once you get here, you can find a nice hotel to stay in. There's no lack of that. And you know, the people are great. It's an interesting mix of people, just like we're both expats here in Dubai, but we fit in.
Very well. Well, it was lovely asking you questions.
Likewise, and congrats on your group. It's the
American Moms Dubai.
American Moms Dubai. It's a pleasure to see you and meet you all. I hope to meet more of you in person. But it sounds like a fun group. I'm sure you have fun and share.
We do. We have
ideas
lots of networking events and meetups. You know, moving overseas is not easy, and moving with a family and shifting your children around to schools and what doctors do you go to. So the page is just very informative. It's friendly. You know, when we miss home or homesick, where do you find your favorite cereal? So it's just a mix of everything. And
well, it sounds great.
Yeah. All right, thanks again, Dr. Drew. It was a pleasure meeting you.
You can call me Dr. Drew, Jen. It's been a pleasure talking to you, and I look forward to seeing you again and meeting the rest of your group.
Thank you. Love that.